Good morning guys, my name is Chidewe Marion and I'm going to be presenting on the drug Atropine sulfate. So here's a brief background on atropine sulfate. Atropine sulfate is indicated for relaxation of the upper gastrointestinal tract and colon during hypotonic radiography. And by hypotonic radiography, it is a method for showing the anatomy of the duodenum without interference from peristaltic activity. And here's the chemical formula or atropine sulfate. Now, going down to the mechanism of atropine sulfate. Atropine sulfate blocks the action of acetylcholine at parasympathetic sites in smooth muscle, secretory glands, and the central nervous system, causing an increase in cardiac output and reduced secretions. Also, atropine sulfate has an anti-salivation and anti-muscarinic effect. In anti-muscarinic effect, the binding ACH2 muscarinic receptors is blocked, resulting in an anticholinergic, that is, the blockage of neurotransmitters at junctions within the central nervous system response. Now, going down to the pharmacology of atropine sulfate. Atropine sulfate dries up body fluids and it also slows down gut movement. It also reduces the rate of peristalsis, and by peristalsis, it is a process whereby food moves down the gastrointestinal tract. Atropine sulfate can cause blurred vision to patients receiving chronic treatment. When overdosed, atropine sulfate leads to disturbed speech, hallucinations, fever, and delirium. Under extreme overdose in patients, that is over 1000 milligrams, atropine sulfate leads to death due to paralysis of the medullary centers, and the fatality rate is less than 1%. Now, going down to the route of administration of atropine sulfate. Atropine can be administered by 1. Intravenous, that is the IV method. It is whereby atropine is injected directly into a vein and directly into the bloodstream. And below is a picture of the intravenous method. The second method is the subcutaneous method, and in this type of administration, a short needle is used to inject a drug into the tissue layer between the skin and the muscle. And the picture below also shows the subcutaneous method. The third method is the intramuscular method, and in this method, atropine sulfate is installed into the depth of specifically selected muscles. For example, the ventrogluteal muscle of the hip shown by the picture below. Also, the fourth method is the endotracheal, that is the ET method. Atropine sulfate is instilled as a solution directly into an endotracheal tube for absorption into the circulation via alveoli. For ET administration, we have to note that it is diluted, that is 1 milligram to 2 milligram in 1 ml of sterile water or normal saline before administration. Lastly, atropine can be dropped under your tongue, from where they are quickly absorbed into the bloodstream. Now, going down to how atropine sulfate is used in the radiology department. Atropine sulfate is indicated for relaxation of the upper gastrointestinal tract and colon during hypotonic radiography, and the usual adult dose is 1 milligram intramuscularly. It is also given before an X-ray procedure, like before a radiograph of the colon or duodenum is taken, to decrease mucus secretions such as saliva, since these secretions may intervene with the quality of the radiograph to be taken. Also, the third use of atropine sulfate in the radiology department is that in case that a patient undergoes cardiac arrest during a procedure, it is used to restore normal heartbeat. Thank you.